Good morning, everyone. I'm calling the Health and Human Services Committee of the Wayne County Commission to order here. Madam Clerk, would you take the roll, please?
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki?
Here.
Commissioner Daub?
Here.
Commissioner Anderson?
Here.
Commissioner Baker McCormick?
Here.
Chair Colleen?
Present.
You have a quorum present.
Thank you, Madam Clerk. And before we go to the approval of minutes, I notified a couple of the commissioners early on this call. I looked down the road and the Health and Human Services Committee won't meet again until January 12th. So over the weekend, I thought it'd be important to get an update on what's going on with the COVID vaccine. I want to limit it just to that and what the county effort is. So I got a hold of folks over the weekend, and Dr. Hamami is with us here. I'm sure he has his Zoom calls all stacked up with Lansing and Washington and God knows where else. Maybe he's still trying to get PPE out of Southeast Asia or something. So I want to allow that to go first under new business, that we'll get a quick update from Dr. Hamami and some questions from commissioners, and then we'll go into the business items. So hopefully that meets with the committee's okay. All right, and so we'll go on to item B, the approval of the November 24th meetings. What's the pleasure of the committee?
So moved.
All right, that was either Marecki moved and Dobbs supported or the other way around. All in favor of the motion, please say aye.
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 Aye. Opposed? All righty, Madam Clerk.
C, old business, there is none.
All right. So as we go into new business here, I'd first like to bring Dr. Hamami on. We are embarking on one of the largest public health, what do you want to call it, operations in a long time in this country, getting out 600 million vaccines for COVID. So I know it's early. I know things will change. It won't be a straight line getting from here to there. So we do know some things, we don't know other things. So Dr. Hamami, if I can bring you forward on this, our czar of COVID in the county. And despite the fact that we do know some things, but not others, Doc, could you just give us a brief overview on where the county is and what our participation is in this effort to get all of the COVID vaccines out?
Absolutely. Thank you, Mr. Chair. Good morning, everyone. Mohamed Hamami, Chief Health Strategist for Wayne County. As you mentioned, Mr. Chair, a lot of things are moving and changing as well. So let me start with some of the basics that some might be redundant facts. But as of this Saturday, we all knew that there were 3 phases of rolling the vaccine. The state has even modified that as of Saturday to 2 phases. So we have phase 1 and phase 2. Within phase 1, there are 3 sub-phases, phase 1A, phase 1B, and phase 1C. And these are prioritizing who gets what at what stage. So phase 1C is prioritizing all direct healthcare providers. So these are the health systems, the frontline medical workers, people that are in the ER, emergency room. These are people that are dealing with the COVID patients. And the way the vaccine is assigned by the state is through the CDC, and they assign it by the state, but it is shipped directly from the provider or the vaccine manufacturer to those entities. So the hospitals will get their shipments directly. And then the second priority group in the phase 1A are the EMS, emergency medical workers. And these, unless they are affiliated with a hospital, then these become the responsibility of the local health department to vaccinate. So this is where we at Wayne County, out of Wayne County, of course, will be responsible for vaccinating close to 1,300 emergency medical service workers. And that is all in the phase 1A. Also included in phase 1A are the skilled nursing facilities, both staff and residents, and eventually in the phase after, the long-term care. So those have been contracted with the large pharmacies. Again, the CDC have contracted with CVS and Walgreens, and they are the ones that are going to provide vaccine to skilled nursing facility residents and staff. But those that did not have a direct enrollment with the retail pharmacies are, again, the responsibility of the health department. We looked at the list, we compared the list of skilled nursing facilities that is in out of Wayne County and those that are enrolled, and we identified one skilled nursing facility only that is not enrolled, with a total of 218 between staff and nurses. So these are going to be our priority specifically in phase 1A. Phase 1B is what the state is calling the critical infrastructure. So this includes, it's a very wide umbrella. It includes government workers, people that work in public safety, including police and sheriff deputies, and then essential workers that, again, has a very wide designation, such as teachers, childcare providers, utility workers, transportation, agricultural workers, and all that. So this is phase 1B. Phase 1C is adults with high-risk conditions and people aged 65 and older were in that phase, but we heard unofficially yet that the state are moving those to phase 2. Phase 2 becomes everybody else. So anybody that is not included in phase 1A are going to be included in phase 2, I'm sorry, where we are expecting more vaccine, and we're expecting that this is where the mass vaccination efforts and the provider efforts are going to be happening. As you know, as of now, only one vaccine has been granted emergency use authorization, and that is the Pfizer vaccine. And that is the one that logistically requires what is called a cold chain. So it has to be shipped in certain insulated containers on dry ice. They are included with GPS device and temperature monitoring devices. Once received, they have to be stored in a minus 70 degrees Celsius, that is minus 94 Fahrenheit. And then there is when you take it out, it has to be diluted and then kept at a 2 to 8 degrees Celsius, and then it can be administered. This vaccine, the Pfizer vaccine, is being shipped to entities that can maintain that cold chain. Wayne County has been designated as one of those places, and we are also included as a hub. By a hub, that means we will have the ability to administer the vaccine, but we will also have the ability to distribute the vaccine and store it for those who cannot store it. The Pfizer vaccine comes in trays. The minimum you can order is 1 tray. The tray has 975 doses. We have been told that Wayne County Public Health is going to receive 1,950 doses as this first shipment, and we're expecting it as early as this Wednesday. Once the first shipment is received, the state informed us, we don't know when, but they said that if we receive it on Wednesday, then all following shipments would happen on Wednesday. So we don't have to guess that are we getting a little on Friday or a little on Monday and all that. So that's the system they are having. But we don't know when the second shipment is going to be. It is noteworthy to say that the federal government has purchased 100 million doses of the Pfizer vaccine and 100 million doses of the Moderna vaccine. The Moderna is expected to be probably granted emergency use authorization on this Friday. Of course, that is less fragile, so logistically you don't need all that cold chain, and this is probably going to be shipped to places that do not have the capacity for the ultra low freezer. But we've been also told by the state that we as a health department can get the Moderna vaccine, and we are planning as well to submit to get it. Of course, we wanted more, and everybody wanted more. Even there are health systems that received less than we are getting, and there are health systems that did not receive anything. And I think part of it is because of that limited initial supply that the federal government has secured from the manufacturers. Our plan for the 1,950 doses that we are getting is to follow the same priority. We're starting this Friday with our own vaccinators. So this is where our public health staff, those that are going to administer the vaccine, we will start with those. We also have reached out to the 1,300 EMS workers in the county. We gave them a survey that to tell us whether they want us to go vaccinate them or they want to take the supply and vaccinate themselves. We received some of that survey. We gave them till Wednesday to give us what each EMS entity is their preference is. We are planning to start with our hub building. Many of you who visited the hub building, we have a garage with 2 bays. I think this is how we're going to do it, as a drive-through for this initial stage, because we certainly want to test how the process is happening, and we want to keep it at a control. We are expecting a vaccination capacity of 100 doses per day. We also are very cognizant that this vaccine might have some uncomfortable side effects, so we don't want to vaccinate everybody from one single entity at once where they're all having mild fever or tired or whatever. So we want to stagger those as we go. We are going to be open during the Christmas break to maintain our vaccination rate, and if we get more, and we expect to get more, then this is where we have a plan of doing 3 approaches. We certainly have currently public health staff that can give the vaccine. We are looking to hire more as we need to increase our capacity. We are also looking at third-party vendors, specifically those that are currently performing the testing, since they have testing sites in the field, specifically the D Group and Memorial Health, where they can also administer the vaccine. And this is our next phase in planning how we want to roll it as a mass vaccination plan. We will do something in the future, again, when we have enough supplies. We will probably be considering things such as we did for H1N1, where we do mass vaccination sites. Many of you know the term pod, or point of dispensing. We have 17 agreements for closed pods and open pods in place, and we're expanding those. This is where we can either supply a pod with the vaccine and they can vaccinate their workers, or we can have it as open for the public where we will be doing it. And that's in a very broad picture what our plan is. Again, we are monitoring anything that changes, and this plan is probably going to be tweaked several times.
Perhaps even several times a day, Dr. Hamami, as we roll this out. All right, we're going to go around the horn with questions for committee members. And we'll start. Commissioner Marecki, are you ready to start with a few questions for Dr. Hamami?
Yeah, thank you. Is this a 2-part vaccine?
Yes, both the Moderna and the Pfizer are 2 doses. So the Pfizer and one is 21 days interval and one is 28 days. I believe the Pfizer is 28 days. And we asked, and everybody asked the question, do we split what we have now and save it? And the state said, no, go ahead and give whatever you have as a first dose, and we'll ensure that you get enough for the second dose.
Okay, okay. And these vaccines are not mandatory in any section yet, right?
Not yet, not that we know of. No.
Okay. Thank you.
Thank you, Commissioner. Commissioner Dobb, do you have a question? Yeah, I see you, Glenn. You're next. Commissioner Dobb, do you have a question?
Yes, thank you, Mr. Chair. So one thing that I've heard being brought up with areas that are more rural is the concern about opening up the vaccines and not being able to distribute them, and then I guess they go bad after a while, or if you can't keep them cold, there's an expiration time. Do you have any concerns with that in any areas of Wayne County being distributed?
Yeah, so we have clear protocols on how to handle that, and you're absolutely right. The vaccine is good for 6 months as long as it's kept at the -70 degrees. Once it is thawed and it's kept at 2 to 8 degrees, and this is where you reconstitute it, it is good for 5 days. At room temperature, it is good for 6 hours only. So that's why each one of those trays have vials. Each vial is a 5 doses. So the protocol is you do not get anything from the freezer that you do not know that you are going to be using immediately. And this is where all that is planned ahead of time. And this is something that not only for this vaccine happens to have more fragility, but everything else, even the flu vaccine or even the childhood immunizations. Whenever we do field, we use temperature controlled containers. Everything is data logged. We have monitoring devices that keeps the integrity of the vaccine, the temperature variations and all that is documented.
Okay, and then you don't anticipate any issues with expiring, us opening up vaccines in Wayne County? We're not.
No.
Okay, all right, great. Thank you. That's all I had.
Thank you, Commissioner. Commissioner Anderson?
Yeah, thank you, Mr. Chair. Dr. Amami, could you address the storage issue? Are we prepared for freezers? I mean, do we have freezers right now? Because I believe we just approved some dollars to purchase a freezer, and I just haven't seen anything come through for those. Are we sharing those freezers or using that space with some of the medical facilities? Is that what we're doing in the short term?
So this is a great question. Christmas came early this year, and we had one freezer from the state. So we currently have a freezer in the HAB building. It's plugged in, and it's being monitored for temperature and all that. So we currently have the capacity for 50,000 doses in one freezer. And as you mentioned, we requested another freezer that has been approved, and it should be coming our way. So 100,000 doses is probably more than enough, but we also have some plans and backup plans where we can use some of the hospital systems, specifically Beaumont, to store some of the excess if we have some. And this is again part of the protocols and the plans that we have in place.
Okay, appreciate that explanation. I know Macomb County, I think, has purchased enough freezers that they're going to actually share space if necessary too. So sounds like we have a good plan in place. Thank you. That's all I have right now.
Thank you, Commissioner. Vice Chair Baker McCormick, questions?
Thank you, Mr. Chair. Just a clarification of once you receive the shot, how quickly do you need to take that second shot?
So the 2 doses have between 21 to 28 days, depending on the vaccine manufacturer. I believe the Moderna is 21 days and the Pfizer is 28 days.
And so when you take the first shot, are you coordinating with them to take the second shot? Or are you doing that by appointment? How are you going to ensure that the second shot is taken within that time? And if they don't get it within that time, is there, do they need to start the process all over again?
Great question, and the first part is much easier to answer than the second one. Let me start with the first one. So absolutely, it's just like let's simplify it to childhood immunizations. As you know, we do it at 2 months, 4 months, 6 months. So you get the first shot, you are scheduled immediately for your next appointment. So for the second dose, there are several tools that the state is putting in place. There is a text messaging tool once you're registered to receive it. As a reminder, there are mailing postcards as well. We certainly are going to follow up and call them. And then finally, there is the traditional vaccine card that you have it that says your next shot is on such and such date. So this is part of how we are going to ensure that they are reminded constantly and we do not lose any of the first dosers to get their second dose. The second question is something that we still are not clear on. We're waiting on direction from the CDC to say, is there a grace period? So instead of day 28, you showed up at day 30, can you still get it? Or if you are out of that window, what does it mean? Do you have to go back and get the first dose and then get redosed? Or can you still get the second dose? So this is still not clear, and we do not have a clear answer on that.
And then my last question, you said earlier that EMS workers would be given their shots and they would take them whenever they would like, or I just wanted to clarify how that works.
So we received, as I mentioned, we distributed a survey. So we received some of the surveys that said we are capable of administering the vaccines ourselves to our workers. And I think this is good because we can then have the EMS that have been vaccinated to vaccinate others, and this increases our capacity. Of course, if this is the case, then all the protocols of maintaining the cold chain should happen, and we need to ensure that when they get it, it is still controlled, how they reconstitute it, they give it within the time window and all that. So this has to happen. And we also need to ensure that the data is logged in the MICR system, which is the vaccine registry, to capture everybody. So there is that possibility. For those that do not want to do this, then they will be part of our plan to do the drive-through through the hub building where we can give them the vaccines.
Okay, and so so you're not physically giving them the vial to take the shot themselves. That's not what you're saying, or
no? Some might, yeah. If they want to do that, we will.
Okay, so my concern with that is, will it be an ability for someone to take the shot and give it to someone else or sell it, or create this black market of, you know, of the virus vaccine where people are selling it, or I don't know. I just don't know how you regulate if you give it to them, whether they took it or not.
Yeah, so currently we do have, or in the past, we used to have what is called the VFC program, where we would give clinics or physicians, specifically pediatricians, we would give them doses of vaccine and they administer it to their patients. Of course, there is a strict protocol and inventory. So if you're in a fire department and I give you 10 vials, then everything is documented with a log number, with a lot number of the vaccine, the manufacturer and the date and all that. And then there is an expectation to get back all the registries of who got it and who didn't, and all this. So there is a checks and balances where we can mitigate any of these possibilities.
Thank you.
Pleasure.
Anything else, Commissioner?
No, that was it. Thank you.
All right. Commissioner Marecki, you had a follow-up question?
Yeah, thank you, Mr. Chair. Doctor, I've heard that they're warning people that have allergies to maybe not to get the vaccine. Could you tell us what kind of allergies that they're talking about, and what other kind of side effects are they seeing with this vaccine?
So let me do the second part. The side effects so far that have been reported are minimal side effects that are associated with any of the current vaccines. So there is a mild fever. Some people might feel fatigue. There is soreness at the injection site. There is a flu-like symptom for 24 hours. And of course, they vary in severity based on everybody's different response to that. So we're not expecting anything that is beyond that would last more than 24 hours. In terms of the allergies, as you know, the United Kingdom went ahead of us and they used this vaccine. And there were 2 cases where there was a severe anaphylactic shock in 2 individuals. And when they investigated it, it turned out that those 2 individuals had a pre-existing severe allergic susceptibility, and they even carry with them the adrenaline shot. So they are expected to have such a reaction. So that is a precautionary thing. If you have severe allergies and you are known to have to need the EpiPen with you and all that, then this is where the contraindication is. One thing about this vaccine is that it's not, as you know, Commissioner, many vaccines use proteins, or they use different things that can be allergens. For this, the only vaccine part is the nucleic acid, which is the mRNA, which is not an allergen by itself. So it might be some of the components of what makes the other, maybe the diluent and all that, but we're not expecting any allergic reactions unless there are very well-known and documented allergic susceptibilities, and this is where caution is to those that might have it not to get it.
So would like a severe peanut allergy be something that you'd have to worry about? I mean, some of these people with this allergy, I mean, can, go into major issues.
It is beyond peanuts. It has to be like mass allergies, like you're allergic to so many different things.
Okay. All right. Thank you.
Thank you, Commissioner.
I'm all set. Yeah, thank you.
All righty. Yeah, thank you, Commissioner. Dr. Hamami, when we usually do this health stuff, Wayne County has a health department. The largest city in the state of Michigan is also in Wayne County, the city of Detroit, with their own health department. Usually we get grants and whatnot from the state, and the city gets their own. I have not seen that the city of Detroit has been designated as a hub by the feds for this, or whoever designated the hubs. So what is the working relationship going to be with the city health department here, city of Detroit?
We always coordinate with all our colleagues in neighboring counties and specifically with the city. We were surprised to know that the city is not scheduled to receive any doses in this first shipment. We reached out to the health officer and they were as surprised. We certainly are in dialogue to see what is needed. Now, most of the city of Detroit is where the big health systems are, and these are receiving theirs directly. So there is that balance, I assume. But if there is a need where there are surplus of vaccines somewhere and shortage at others, the state has a clear process of what is called redistribution. They still want to maintain the count. They still want to know how to do it. I think there is a specific mechanism where we can say someone has more and we need that, and how do you reassign them to us?
I got you. Well, that's good that they have that. And I guess typical governmental bureaucracy, it's not going to be 3 steps. It's only going to be 2, but we're going to have several sub-steps now under 1. So whatever. By the time they get to non-essential workers like, I don't know, county commissioners, I'm assuming that April is the window frame I'm looking at as a citizen for when this becomes available. What's your opinion on that, Doc?
That probably is a safe estimate. If we maintain a consistency in the doses provided, those phases can overlap and they can happen simultaneously at some point. But it might be safe to assume that when this is going to become open for the public, then we're probably looking at spring as that. And this brings us to the need that we should not let our guards off. So it would still be, face covering and social distancing and restrictions and all that until we reach that point where 70% of the population is vaccinated.
70% is the magic number for the so-called herd immunity that people talk about, but very few understand.
That is correct. It's when
Okay, 70%.
It's when the majority of vaccinated would protect the minority unvaccinated.
Well, that's good. I've kind of been using the number 80 to 85, so 70 will. Okay. Well, thank you so much. As you indicate here, Doc, I mean, this is going to be changing. A month from now, we will have a track record, much more of a track record of things like side effect of the vaccines and all of that kind of stuff. And it will still be a real minority of citizens who will have been vaccinated by 1 month from now, but there will be much more of a track record. So Dr. Hamami, if we can invite you back for our, I think it's January 14th or 12th date, just for a little update, because I think it is so important that good information gets out there, the right information, that elected officials that are putting out newsletters and talking to their constituents can also be very helpful in putting what the accurate story is out there, because we got some months to go on this, and
Sure.
and it's not going to be easy, but yeah, mask up, social distance, wash your hands, right, Doc?
Correct. And I'll be more than happy to come back, Mr. Chair.
Well, thank you so much, sir. Any other commissioner have a question at this point before we return to the agenda? All right. Again, Dr. Hamami, thank you so much for joining us today. Now get busy with your Zoom calls.
All right.
And I'll go back to the clerk. Madam Clerk, what's next on the agenda?
Item D1, under new business, requesting commission approval of an extension of a 2-year comparable source contract with Country Chicken.
I guess I should mention real quick also that we did get another addenda today. It came this morning, probably about 10 o'clock or so, 9:30. So colleagues, if you didn't get that, there's a 1-item addenda that came out this morning. Okay. This is the contract for Country Chicken. Who from administration is going to introduce this, please?
Through the chair, Joan Savrakis, Division Director, Senior Services.
Good morning. Welcome.
Thank you.
What is this?
This is a contract extension to Country Chicken for the provision, preparation, and delivery of halal home-delivered meals for Wayne County Senior Services. Halal meals are currently being delivered twice per week. Recipients are receiving 3 meals on Mondays and 2 meals on Thursday, and continued service through the halal meal program has gone uninterrupted through COVID.
Excellent. Thank you.
Thank you.
Questions? We'll start with Commissioner Marecki. You have questions on this item?
And as I recall, that Country Chicken is the only provider, right, that does these meals?
Through the chair, to answer your question, we were in the process of conducting an RFP when COVID hit, and of course, all the restaurants closed. We hope after the pandemic is under control that we will be able to solicit to see if there are other vendors. But in the last RFP, Country Chicken was the only vendor providing the meals.
Thank you.
And I believe they were the only vendor on the previous RFP as well.
That is correct, Commissioner, yes.
Yeah, thank you. Commissioner Dobb, you have questions on this item?
No questions, thank you.
Thank you. Commissioner Anderson?
Nothing at this time. Thanks.
Okay. And Commissioner Baker McCormick?
No questions.
Okay. There is, Ms. Savrakis, there is a 1-year extension to be had under the current contract?
Actually, there was not a 1-year extension. However, in order to avoid interruption in service and because we were unable to solicit, we requested an extension.
Yeah, so there wasn't an extension in the contract, but because of the situation with getting the RFPs out. So we're extending this for 1 year. And the hope is, Dr. Hamami, pokes everybody in their shoulder. Nice, deep intramuscular, and by this fall, we will be able to RFP.
That is the plan. Yes. Thank
right.
you, Commissioner.
Thank you. Okay, pleasure of the committee on item D1.
I'll move for approval.
Yep, I'll support.
Commissioner Dobb moves, Commissioner Marecki supports. All in favor of the motion on the floor, please say aye.
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 All opposed? Are there any abstentions? All righty, thank you. Madam Clerk, what's next?
Item 2, requesting commission approval of Amendment 1 to a 5-year contract with a 1-year option to renew with Spectrum Juvenile Justice Services.
All righty, who's introducing this from administration?
Hi, this is Cecily Hoagland,
Yes, ma'am.
Administrator in Juvenile Youth Service Division, HHVS. And this is a 1-year option to renew the contract with Spectrum for residential and detention beds.
And what are they doing at that residential?
Providing services for youth based on their assessments. Whatever their assessments, they're providing services such as in substance abuse or substance abuse, and they have other services too that they provide. Let me check really quick.
But this is a secure residential facility, correct?
Yes, it is.
Yeah. Okay. All right, let's see kind of questions commissioners may have on this. Commissioner Marecki, you seem to be first in the starting gate. Do you have questions?
No, I'm all set with this.
All
Thank
righty.
you.
Commissioner Dobb?
No questions. Thank you.
All righty. Commissioner Anderson?
No questions.
All righty. And Commissioner Baker McCormick?
No questions.
I did notice in the paperwork that Spectrum has stolen from the Detroit Wayne Integrated Health Network, our former medical director. I see they've taken her over there, so we'll settle that one out in the alley somewhere. All right, and I have no questions either. So what's the pleasure of the committee on this one?
Move approval. Anderson.
Anderson moves.
Support, Marecki.
Marecki supports. We have a proper motion on the floor. All in favor, please say aye.
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 Aye. Opposed? Any abstentions? All right, we're ready to roll the agenda to item D3, please, Madam Clerk.
Item 3, requesting commission approval of a grant agreement with the Michigan Department of Health and Human Services.
Okay, somebody from the department to introduce what are we going to do with this $120,000 in a grant from the state of Michigan. And while you're here, this doesn't say CARES Act. Is the state giving grants relative to COVID under a couple of different, they have a couple of different ways to get funds out to their local government?
Hi, yes, this is Carol Osterberry from.
Good morning. Thank you for being here.
Yes. And right, this is the state of Michigan Department of Health and Human Services got CARES Act money, and then they distributed it out to the local health departments. So that's why this funding then ended or will end, December 30th. So it was their CARES Act money that then they got out to us for COVID response.
It was their CARES Act, and then
Right.
they took some of their money, just like we've been doing in the county, and distributing it to local cities or counties, correct?
That is correct, yes.
All righty. So what are we looking at today, Ms. Osterberry?
Right. So with this money, we've purchased vehicles to transport supplies for those events, machinery and equipment, also those 800 megahertz radios that we use when we're out on those big sites, computer equipment, rugged iPads, and then contractual services for our call center is what has been allocated for this money.
So this is going to be providing the infrastructure for vaccination sites so that they
Yes.
have all of their equipment.
That is right.
All righty. All right, we'll go around the horn on questions then. Commissioner Marecki.
I am all set. One question that's deviating from this. Carol, if our local communities have any questions about this whole vaccine process, is there someone that the commissioners could contact with like specific questions if our locals have questions?
Certainly, you know, myself, Dr. Hamami, you know, again, as, you know, he just presented, you know, we've got this plan and, you know, working through it and, you know, being very flexible as the changes are coming down from CDC through the state. But yeah, certainly either of us, we can certainly get those questions and make sure they're routed to the correct person. Yep.
Okay. Yeah. Thank you. I appreciate that because I do anticipate as I speak, there might be questions too. So
Sure.
I appreciate it, but I'm fine with this item. Thank you for indulging me, Mr. Chair.
Thank you, Commissioner. Commissioner Dobb.
Thank you, Mr. Chair. So the term of this, or the end date of this grant is the last day of this year. Do we need to spend all of the money by the end of this year? And if so, have we done that?
Yes and yes.
Okay,
Yes.
great. Thank you. That's all I had.
Thank you.
Thank you, Commissioner. Commissioner Anderson, you're up.
All set. Thank you.
Vice Chair Baker McCormick.
No questions.
All right. What's the pleasure of the committee on this item then?
I'll move approval. Dobb.
Thank you.
Support Anderson.
Yeah.
Thank you. Properly moved and supported for getting 120,000 down here that we've already spent getting ready for COVID vaccinations. All in favor of the motion, please say aye.
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 Opposed? Are there any abstentions? Okay, Madam Clerk.
Item 4, requesting commission approval of a grant agreement with the Michigan Department of Health and Human Services.
Okay, how is this different than
Right.
the last one we looked at?
Very good question. Yes. So this is, you know, for a little bit more money. And we were able then to use this for contractual services and staff, you know, to administer vaccines at those mobile sites. And remember how Dr. Hamami was just talking about, you know, refrigerators, freezers. Yes, we got the one big freezer from the state, but in anticipation of needing more, you know, just to make sure we have enough capacity here, we've ordered more of those. And even when, you know, like he explained, you know, this is a very fragile vaccine, very particular for when it gets, you know, reconstituted and, you know, put up to room temperature. So I wish I could describe these. They're like these portable coolers that then we can take out on the sites and they maintain the temperature for us. And we even have a temperature probe right in there. So we, those are very valuable, and having many, you know, sites out there, they are critical to the whole vaccination program. And then again, just, you know, those medical supplies for use at vaccination events, everything from drape cloths to the sharps containers. We get a lot of supplies with the vaccine, but there are some supplies then that we also need to purchase.
Thank you. Commissioner Marecki, any questions on this one?
No questions. Thanks.
Thank you. Commissioner Dobb?
I guess just my same question as last time. We'll be able to spend all this money by the end of the year? Okay.
Yep.
All right. Thank you.
Thank you, Commissioner. Commissioner Anderson?
No questions.
Commissioner Dobb? Commissioner Vice Chair Baker McCormick. I went backwards instead of forwards. Vice Chair Baker McCormick? One more time, Vice Chair Baker McCormick. I know there's some connectivity problems today. I had heard early on this morning that there was Zoom problems floating around today. Okay, so not hearing from Commissioner Baker McCormick. What's the pleasure of the committee on this item?
I'm sorry. Go ahead.
Oh, that's okay. Do you have questions, Commissioner?
No, I don't. No.
Okay, would you like to make a motion?
So moved.
All righty. Is there support for item D4? Or,
I'll support.
all right,
Lots of
Commissioner
support.
Dobb got in. Yep. Baker McCormick Dobb, properly moved. All in favor of the motion, please say aye.
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 Opposed? Are there any abstentions? Okay, I purposely didn't try to put all three of these grant agreements from COVID money together. This one has to do with contact tracing. So I guess when the department introduces this, and this is also for funds for this year, could you please also, when you introduce this, tell us where we're at with contact tracing in the state, how much are citizens signing up for this? And, you know, as we had just discussed, 70% immunized folks would be good for kind of herd immunity. What kind of percentage of people need to sign up for contact tracing in order for it to be an effective tool? So I guess I'll put that out there, Ms. Osterberry, as you
Right.
describe what item 5 is.
Yes, absolutely. Very, very good. Yes, and again, this was money we received, and we, one of the things is we brought on additional contact tracing staff. And the state has, a few weeks ago, might even, and I say weeks, the weeks go by quickly for me. It could have even been a couple months ago. They actually launched out an app. So someone who is identified as a close contact then on their mobile phone can communicate directly with the contact tracing staff. Contact tracing is really that activity of you've been identified as a close contact, you need to self-quarantine. So someone from the health department checks in with you daily. How are you feeling? Are you staying home? Do you have questions? Have you had any symptoms? That is what contact tracing is, to keep the people who have been identified as a close contact to a confirmed case at home and self quarantining. And yes, things, especially with this app, things have gotten better. We were having more like 30 to 40% of non-response from the contact tracing. That has improved some. Is there a golden percentage that says then contact tracing is effective? Certainly, 30% I get concerned. Anything 15, 10% is better. So we're doing quite well. The state is doing well. We track this, and again, with this money we were able to hire on a lot of staff that really boosted up that team even more so.
Does the department, Ms. Osterberry, have something we can use on social media? I almost never see anything about contract tracing on social media, but to amplify it out there and make
Right.
people aware, hey, sign up for this. So do we have something we can use to
Yeah.
help accomplish that?
Right, we do, and I know the state runs public service ads, and yes, and everything with that new app. So, yep, with
Do you have something that you can send to commissioners, like a fact sheet or?
right, I will work with comms on that.
That would be great, because again, it's gonna, hey, we're all in this together, right?
Right.
In this pandemic, which also means to get out of it, we all got to pull together. So
Yep.
anything that we can do with our constituents and the public at large to amplify the message of contact tracing. All righty, Commissioner Marecki, do you have anything on the contract tracing?
Nope, sorry.
That's all right.
I'm
All
all
right,
set.
Commissioner Dobb,
No questions. Thank you.
Commissioner Anderson.
Nothing at this time. Thanks.
All righty, Commissioner Baker McCormick.
No questions.
Okay, pleasure of the committee then on item D5, contract tracing dollars.
Move approval, Anderson.
Thank you.
Support, Dobb.
Thank you. Proper motion before us. All in favor of the motion on item D5, please say aye.
Aye.
Opposed? Are there any abstentions? All righty, Madam Clerk, let's roll the agenda.
Item 6, requesting commission approval of a grant award with the Michigan Department of Health and Human Services for a secure reimbursement program.
All right, and who from the department is going to be introducing this?
Good morning, Chair. This is Shanetta Coleman, Division Director for Juvenile Services.
Oh, good morning, Ms. Coleman. Welcome.
Oh, thank you. What you have before you is the annual grant award that comes from the Michigan Department of Health and Human Services. It is under the Title IV E grant funding, but it's under foster care under that department. But the purpose of the grant actually is for income eligible residents who are placed in a residential facility for reimbursement. So it's a part of the Social Security Administration funds. And so residents who qualify and eligible for reimbursement for their care while they're out of home is reimbursable then back to the county. So we will receive approximately $500,000. And I say approximately because it's based on use for the care of those residents who are placed out of home. This grant award is coming to you late as a result of the late notification from the state of Michigan, for which we were informed about mid-September, I think around the 16th of September, that those funds would be available and that we needed to respond by September 30th of this year, although the effective date is October 1st.
Yeah, I love when the state sends stuff and says you got 4 days to get this back to us. Dr. Coleman, if I have this right, we're going to get $500,000 from the Michigan Department of Health and Human Services. And it's actually going to be Assured Family Services, the former JAC, that is going to supply the services and the administration of this, and then we reimburse Assured Family Services. Is that how it's going to go?
So Assured Family Services is our assessment center, as you're aware, and Assured Family Services, their role in this whole process is that when youth come in, they determine the eligibility for us to, make sure that the youth is eligible. They complete the actual application and they submit that application out to the state of Michigan. Once those things have been approved and deemed eligible, then the funds come then back to the county. The county then is able to offset residential costs associated with that young person's care once they've been placed out of home. So Assured Family Services definitely plays a very significant role in the process, but the $500,000 does not go to Assured Family Services.
So who does the $500,000 go to? I'm still a little bit hazy here.
So it comes off of the total cost of residential care. So in essence, it will diminish the out-of-pocket or the cost to like our care management organizations for the residential care that they will have to pay for.
Okay, I think I get that.
So basically, as you know, with the child care fund, the county is still responsible for 50% of the care.
Right.
So if we were not to receive that $500,000, all of that money would come out of the county's general fund.
I see. Okay.
Yes.
That clears up a lot of stuff for me there then. Thank you.
You're welcome.
All right. Commissioners, Commissioner Marecki, questions on item D6?
Nope, all set. Thank you.
Commissioner, thank you. Commissioner Dobb?
No questions.
Thank you. Commissioner Anderson? I'm making him work to go to his mute button. Commissioner Anderson? Commissioner Baker McCormick?
I have no questions.
All righty. How about a motion, Commissioner Baker McCormick? You got one of those?
So moved.
Support.
Thank you. And that
Correct.
was, I believe, Marecki.
Yep.
So Baker McCormick moves, Commissioner Marecki supports, approving getting the grant for $500,000 for foster care placement. All in favor of the motion, please say aye.
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 Opposed? Abstentions? Okay, I guess we got to do this item number 7. Madam Clerk, what is it?
Item 7, requesting commission approval of the reappointments of Commissioners Alicia R. Bell, Monique Baker McCormick, and Tim Killeen to the Health Choice Board of Trustees.
Holy cow, do we got resumes and background checks on these people? Pleasure of the committee.
Move for approval.
Yep, and I'll support.
Dobb moves and Commissioner Marecki supports the reappointment of the three commissioners to the Health Choice Board. Just to remind people, Wayne County has a health plan, a 2-share plan that we offer to small businesses in Wayne as well as Oakland County now for the last couple of years. So that it's a good plan and relatively low cost to allow small businesses to be able to supply health care for their employees. All right, we have a motion. It has been seconded. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Are there any abstentions? Okay, Madam Chair, I guess, or Madam Clerk, I guess we're going to the addenda now. Madam
Can everyone
Clerk,
see the addenda on the screen?
yes, we have it. Yep.
Okay. Item 8 on the addenda, requesting commission ratification of the chair's exigent approval of a subrecipient agreement with National Faith Homebuyers.
All righty. I'm going to take a guess and say it's our department director for the Wayne County Veterans Department that's going to introduce this. I could be wrong.
You are correct, Commissioner. How are you doing?
Oh, holy cow. Good morning. Good to see you.
Good to be seen, sir. Good to be seen. So I'm excited to announce an opportunity to provide 6 weeks transitional housing for all veterans in Wayne County, and it's with a partnership with the National Faith Homebuyers. And at this moment, I'd like to introduce or present Ms. Dina Harris, the president of National Faith Homebuyers, to kind of walk us through what this opportunity presents.
That would be great. Thank you, sir.
Well, I hope you can hear me. I don't see me, so
we
I'm
can.
assuming.
We can hear you.
Excellent.
We see you. We hear you.
Okay. We sort of have a 3-phase operation going. Our project is called Operation Homebound. And what we'll be doing are we've recruited 3 churches in the Detroit area to house homeless veterans. The pastor, Alonzo Bell, I believe is on with us. I asked one of them to join us, and they have the facility sitting empty. So it was a perfect time to get them to use their spaces creatively. We also will be utilizing their parking lots. We were told by the Quise Vesseray that we would, some people were uncomfortable staying in a space, so we will let them stay in the parking lot. Mm-hmm. The second phase is that we have some housing sitting available, so we're going to put it together and make it available to veterans permanently. At this time, we have 7 parcels that we are able to put in operation. Most of them we got from the land bank. So we will put them in operation and place veterans in them permanently. And the third phase is National Faith has a long history of finding housing and helping veterans get into housing. And so we will be working on placing them into transitional and permanent housing. Well, this sort of snowballed because what we started out as a really great plan, snowballed to the Detroit Pistons, Delta Dental. The couple of labor unions have now donated sleeping bags. So it looks as if we've gotten off to a great start, and we started marketing for our veterans as of this past weekend.
Thank you, Ms. Harris. I do want to ask you one quick question. Does National Faith Homebuyers do any other work for Wayne County in providing housing solutions?
Yes, we do. As we have been managing the county's down payment assistance program for home ownership since about 2004.
Yeah, that was a leading question. I got here in 2006, and I've of course been doing work with you ever since.
Yes.
So okay, thank you for that. Commissioners, we'll go to questions on this. Commissioner Marecki.
No, I'm all set, but congratulations. This is a great great projects. So thank you for that.
Thank you.
Commissioner Dobb?
No questions. Thank you.
All righty. Commissioner Anderson?
Are these, yes, thank you. Are these facilities, locations, are they, any of them outside of the city of Detroit?
Not at this time, no.
Okay. Can we, will we be exploring that?
We absolutely will. As you know, we serve the county-wide. And so we certainly, this was sort of a pilot to see if we could actually change the lives of our veterans. And I've had probably 10 churches reach out outside of Detroit that want to join this project.
Okay. Yeah, there's some veterans organizations too. I know one in particular that's in the city of Wayne, Veterans Haven. I think they still have some housing that could be made available, I'm sure, and might be able to help open up something else for another purchase or something. So I'm just thinking Western Wayne and Downriver and other parts of Wayne County might be, we have veterans, of course, everywhere.
Absolutely. I don't know if many of you are aware, but every year we've given a home away to a veteran. And if you see our website, you'll see that Wayne County has been our partner in almost every successful project that we've done. So we anticipate going outside the county if this works well.
All right. Thank you.
Thank you, Commissioner. Vice Chair Baker McCormick?
No questions.
All righty. Thank you. Ms. Harris, I want to come back to you with one more, and this is always difficult for the homeless and the homeless vet and the subsection of the homeless, which are vets. Do you have any way of gauging what the true need is out there for these homeless services?
We don't at this time, Commissioner, but we certainly intend to have an answer to that in the next 60 days.
Yeah. Can you tell us for right now, just for National Faith, how many veterans you have been able to place in homes?
Oh, we've been doing this for 24 years.
Yeah.
And in the past, let's say even in the past year, we've been able to place 10 veterans in homes.
Yeah. You know, it's always, we talk big money a lot. We throw around a lot of big money in this country. And then for these intensely human services, always fighting for scraps off the table to get this kind of job done. All right, that's my editorial. Pleasure of the committee on this item.
Move approval.
Thank you, Commissioner Anderson. Is there support?
I'll support Dobb.
Thank you, Commissioner. Moved and supported. All in favor, please say aye.
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 Opposed? Are there any abstentions? All righty. Madam Clerk, what's next?
E, such other matters as may be properly submitted before the committee.
Does anybody have some matter? None's been submitted to me. Does anybody have something to raise at this point? Hearing none, we'll move the agenda. Madam Clerk.
Public comments.
Now, I do believe we got a email public comment.
Yes.
How did that work from our last meeting?
Yes.
And it came in as email. Does somebody from staff have that and we can read it into the record?
I have that. Would you like me to share it on the screen or you want me to just read it?
Is this Ms. Lewis, our clerk?
Yes.
Yeah. If you would just read it, please, Ms. Lewis.
Okay, this is from Suzanne Yarbrough. It says, to all government employees of Wayne County, Michigan, the Michigan Supreme Court ruled on October 20th, 2020 that now accordingly, all of Governor Whitmer's executive orders passed April 30th, 2020 lacked any basis under current Michigan law. That being said, why is Wayne County, Michigan going along with Governor Whitmer's contempt of court orders that she is violating? The word health is mentioned once in Michigan Constitution. Article 4, Section 51 states that legislature shall pass suitable laws for protection and promotion of the public health. That being said, no law states Director of Michigan Department of Health and Human Services Robert Gordon, shall pass laws nowhere. Why is Wayne County, Michigan a willing participant on blatantly violating the Michigan Supreme Court ruling of 10/2020? Wayne County, Michigan government employees are hereby put on public notice to cease and desist continuing MDHHS Robert Gordon health orders, as he is not the lawmaking body. Violating separations of power is the biggest form of tyranny here. Not any law to wear a mask is there either. Please keep the oath of office that you took to protect and defend the Michigan and U.S. Constitution. Sincerely, Suzanne Yarbrough.
Thank you. Do we have any other email comments that have come in today before I go to the phones?
We haven't received any other emails other than that one. No.
All righty, thank you. Is there anybody on the phone that would like to have public comment to the Wayne County Health and Human Services Committee this morning? Is there anybody on the phone looking for comment? They can just unmute themselves as they do, Madam Clerk.
Yes.
Okay. So I'm going to put a third call out for public comment. If you have some, just please use your little icon and unmute yourself. Is there anybody that would like to have public comment for the Health and Human Services Committee? Okay, hearing none. Madam Clerk, what's next?
Adjournment.
Okay, is there
So
a motion?
moved. So moved.
Okay.
Correctly.
Yeah,
Support.
great. And the chair rules that not hearing any objections, we stand adjourned. Thank you, everybody.
Thank you.